Hi everybody, it's Dr. Platt again with another episode of 50 Ways to Jumpstart Your Implant Practice on Monday morning. And today I'm briefly going to talk about how we use models in our office to educate the patient. Of course, most people use models today. They're obviously very plentiful. Many of the models that everybody's familiar with is the model that Straumann originally put out with the implant, and it will obviously give you what you need to do to cut teeth down. Most people have that model. That's a great model that we love to use. Of course, your overdenture models, both upper and lower, I think are very important to show folks what they'll be getting when the time comes. And then of course you have models for abutments, models for healing caps. In my opinion is these should all be in operatories as well, at least the basic models, because people come in that aren't necessarily here for the implant that day, but having your staff talk to them regarding what implants mean using models is very, very helpful. When we talk to folks about full arches, I actually like to use two different models for that. One is a little cheaper version. I have no idea even where I purchased this, but it comes off and on. And what I will do is say this is the temporary, it's a provisional. We like to be in a soft diet while you're in the provisional. Then I have another one from one of the implant companies that we purchased that's way nicer. So it looks like a final basically, and then we just discuss the fact that there's a titanium bar on the inside of it. And most of my restorative doctors are still doing titanium as opposed to zirconia. A few models that you may not have that I would highly recommend. I think I had to have this one custom made. It's nothing more than a denture, because most people don't really realize what a denture is going to look like. And oftentimes, you know, if we talk to them about, okay, your options are a full denture versus fixed removable overdenture versus all-in-4 or full arch type procedure. When they see this, they immediately would like to go to something with not nearly as much plastic, not nearly as much palatal coverage. So have one of your labs make you a denture if you don't have a denture, basically. The other thing that I had a lab make me a flipper, because a lot of folks in my area still use flippers for temporaries, which is fine. And it just allows my implant coordinator, Monette, to show folks what a flipper looks like. And then finally, people really have no idea a lot of times what a partial looks like. Believe me, if they see a partial with that kind of metal on the palate, a lot of times they're like, nah, that's not for me. So at least they're educated as to what the options are. So in a nutshell, invest some money in models. Some of them aren't that cheap, but boy, I tell you what, it really educates your patients and will allow them to make a more educated decision moving forward. Hope this helps. You guys have a great night, and we'll talk to you next week.